All right, welcome back to the Elias Macko Show. We now go to Dr. Paul Saba. He's a family physician, practices in Lachine, a graduate of McGill University, and he caught my attention this week. He penned a piece in La Presse, and it's titled, Where is my family doctor? If I do the translation from the French, I immediately thought of that movie, like, Dude, Where's My Car? I think a lot of Quebecers are asking, Dude, where's my family doctor? So let's talk about where those family doctors are. Dr. Saba on the line. Dr. Saba, welcome back to the program.
Thank you, Elias.
So let's talk about this here, your piece in La Presse. I took interest for two reasons. One is you lay the groundwork on just why family doctors are important. Why don't we start there before we get to what I would say maybe some simple solutions? What should we be talking about just on the importance of family doctors?
Well, family doctors, first of all, they're the first contact for the population when they have any health challenges. They provide diagnosed treatment of diseases. They do screening tests for cancer and heart disease before people actually end up having these diseases, and they also do lots of preventive care. Our doctors in Quebec not only work in offices, but they also cover the emergency room, intensive care. They do hospitalizations and long-term care, which is somewhat unusual in this province. We do a lot more than many other provinces, which often have other doctors, specialists taking care of those areas. And without them, acute illnesses go untreated. People end up lining in overcrowded emergency rooms. We all know people who've waited. We may have waited ourselves 8, 10, 12 hours or more.
15, right here. 15 yeah, I've been through it.
That's right. And in the long term, early diagnosis of treatable diseases are delayed or go untreated until they're too far advanced for successful treatment. And it's also been shown that cost to taxpayers is 5 to 10 times higher when people end up going to the emergency room rather than being seen by their family doctor in their office. And also, we know that patients who are cared by family physicians have better survival rates, are hospitalized less, and use less medications. And there are lots of studies out there showing increased death rates whenever you have a lack of family doctors. And the Stanford and Harvard Medical School looked at 100,000 population, and where there was, by increasing 10 family physicians to 100,000, that's 1 per 10,000, you reduced cardiovascular deaths by almost 1%, also 1% for cancer, and 1.4% decline in respiratory deaths.
So you're saving lives, and for a government like the Quebec government that is so focused right now on cost cutting, and people talk about austerity here, you can make the case that spending money on family doctors, which leads to more preventative care, will pay off and then some when it comes to at the end of the day, compared to people going to the emergency room.
Yeah, and then you have to ask yourself, the way I look at it, it's a necessity. It shouldn't be a luxury. So everyone's like seeing family medicine. Well, we created this problem, and there's no way we can solve it. It's insolvable. And I've always believed in the Good Samaritan model of healthcare. It means we got to take care of everybody, especially people who are in need. And it's not just the Good Samaritan is actually entrenched in our Quebec Civil Code here in Quebec, and we're the only province to have Good Samaritan laws. And it's not just taking care of somebody who's actually in a car accident, stopping by and doing first aid. It's taking care of people from birth to the end and natural end of their lives. And this was taught. I mean, originally the Good Samaritan, the stories in the Bible, but Sir William Osler, who is really the ethicist, the modern day ethicist, and graduated from McGill, used the Good Samaritan as his model for healthcare, and he was a graduate of McGill University like myself. So I believe in that.
So we're with Dr. Paul Saba, a Montreal family doctor. We're talking about a piece he has penned in La Presse. Now, here's the thing, Dr. Saba. A whole section of your piece, right, is all about the solutions, right? Yes. And, I was just struck. You use like basic math and you just make the case on numbers. And dare I say, it almost seems like the solution is simple and dare I say even easy when you look at it the way you present it. So why don't you tell us about the solutions here?
Okay, well, we have about 10,000 family physicians in Quebec. Not all necessarily do family practice office, but lots of them do. And I came up with a number. I actually had to readjust my number since I wrote the article, because I had originally thought that each doctor should take 1.5. Then I said maybe one, and then I have to recalibrate, which I did. I sent it off to La Presse. But it's basically 500,000 patients per year. If each of the 10,000 took one patient per week, they could take more. They can take two. They could take three. I actually take lots more than that per year. That would be 500,000 per year, and we have about 2.25 million people don't have a family doctor. So in a little over 4 years, 4 years would be 2 million. Everybody would have a family doctor. The other thing would be to encourage family physicians over retirement age. Family doctors often don't retire, but some do. 65 and over. Give them incentives, give them tax credits. I did some calculations, but I will leave that to the Federation and the government to discuss what's reasonable and fair. We have, they say there's going to be about, in Quebec, it works out to be about 4,400 shortage of doctors in the next 6 years. And if we can increase our enrollment, that's about 733 physicians per year. If we can double up our enrollment in the medical schools, government's already said they're going to take on 400 new students a year for the four medical schools. But if we could double up to 800 in 6 years, 800 times 6, that's 4,800 family physicians. That shortage will be resolved. Mm-hmm. So we can solve it in the short term, right away, in the next 3 to 4 years. And then long term over the next 6 years, so we wouldn't face this shortage ongoing.
Can I ask you, just to wrap up here, Dr. Saba, because I know there's been a battle in Quebec between doctors and the province. Yes. Some doctors are pushing back on this, the push to get them to see more patients here. What is your take on that battle? Is it true that some doctors do need to make efforts to see more patients?
Yeah, I think so, but you also have to incentivize, because lots of them are attracted to the private because, but when I was going through medical school and I did my residency, everybody was saying, Paul, you should go into ophthalmology, go into radiology, make lots more money, which is true. But I always had a heart to take care of people in the front lines, and I worked in the emergency room many years, ICU. Now I'm mostly office based. I still do some work in the hospital. But it's, we need to make it value. We really have to value the family physicians, and they need to feel valued. And it's not just with money, but money helps, and you need to put money there so they can take on more. And I think that most of the family doctors that I've worked with are really committed. They want to sense that they're valued, and they value their patients, and they go far beyond the call of duty. And I want the government to look at it from that perspective and not see them as the enemy. We can solve this problem. It's not impossible.
The piece in La Presse is called Où est mon médecin de famille? The author, Dr. Paul Saba. Dr. Saba, thanks so much. Appreciate your time.
Thank you so much, Elias.
Dr. Paul Saba is a family doctor in Lachine.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years.
And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.